And let's bring in Vaccine Education Center Director and Infectious Disease Physician at Children's Hospital of Philadelphia, Dr. Paul Offit, for more. Dr. Offit, thank you for coming on. You were on the FDA's independent vaccine panel before your time was cut short last year. So how do these meetings usually play out? What's the process?
Well, the way it normally plays out is that you have a working group that sort of addresses the issue often for 6 to 10 months before you ever meet. Then the people who present have their presentations reviewed by subject matter experts. None of that is going to happen here. These are basically a group of science denialists and anti-vaccine activists who comport with RFK Jr.'s false beliefs about vaccines, who I suspect are about to make a terrible recommendation, which hopefully most people in the scientific and medical community will ignore.
And Dr. Offit, Health Secretary RFK Jr. and other federal officials say hepatitis, particularly hepatitis B, is mostly transmitted through sexual contact or needle sharing, so babies don't need a vaccine for it. What's your response to that?
Well, first of all, I can't believe they would ever not recommend today that a child who is born to a mother who's infected with hepatitis B, as screened in the first trimester, needs to get that vaccine. Otherwise, if that child doesn't get the vaccine, they have a 90% chance of going on to develop chronic disease, meaning cirrhosis or liver cancer. So what they're talking about is people who are born to mothers who are not previously infected, who aren't positive in their first trimester. But if you look back when you first recommended this vaccine for all newborns in 1991, half of those 30,000 children who got hepatitis B, less than 10, didn't get it from their mothers. They got it from relatively casual contact with someone who had chronic hepatitis B virus and didn't know it. And it wasn't because these children less than 10 were having a sexual contact with that person, or it wasn't because they were using intravenous drugs. They just had relatively casual contact, sharing, say, washcloths, towels, toothbrushes. And I don't think people realize how contagious this virus is. This virus is 50 to 100 times more contagious than AIDS. And I think people don't quite realize how at risk children are if they get infected early in life.
The committee's looking to either remove the birth dose recommendation or delay the vaccination. Are there any benefits to delaying this shot?
No, the vaccine, you could argue if this vaccine was safer or more effective if you got it, say, at 2 months of age than at birth, you could at least have that discussion, but it's not true. So all you're doing is taking a risk with no benefit.
So what happens if the panel decides to delay or no longer recommend the birth dose? What options would parents have?
Well, I think the American Academy of Pediatrics would immediately stand up and say, you need to get a birth dose. Even if your mother is not found to be infected in that first trimester screening, you still benefit from a birth dose because so many children, less than 10, could still get this infection from relatively casual contact from the millions of people infected with hepatitis B. They'll immediately stand up and help direct physicians.
What about insurance? Would insurance still cover it?
I think so, yes.
All right, Vaccine Education Center Director and Attending Physician at the Division of Infectious Diseases at Children's Hospital of Philadelphia, Dr. Paul Offit, we appreciate your time today. Thank you.
Thank you.